Hello, I'm Guillermo Garcia-Manero from the Department of Leukemia at MD Anderson Cancer Center. And I'm today here at the ASH 2023 meeting in San Diego. And tomorrow we're going to be presenting an update on the COMMANDS trial. So what is the COMMANDS trial? The COMMANDS trial is or was a randomized study of luspatercept versus an ESA for patients with low-risk myelodysplastic syndrome dependent of transfusions. So this study actually was originally presented at the ASCO meeting this past May, followed with a plenary presentation at the EHA meeting in Frankfurt, and the presentation or publication in Lancet today, the paper, the journal with the highest impact factor. But the data that we had presented at those initial meetings was actually preliminary data that was not the full data set. So at this ASH meeting tomorrow, I will be presenting the final update on the COMMANDS trial. And I think this is a very important exercise because I think it's first really fundamental to confirm that the original results that we saw on COMMANDS are actually shown also as you have a more mature data set. And indeed, actually, the data that I will be presenting shows that in general, luspatercept is superior to an ESA as a frontline drug for patients with low-risk myelodysplastic syndrome. So that did not change. The other important issue from the COMMANDS trial was the duration of response. What I refer to as quality of response was also in favor of luspatercept versus the control arm, the ESA. So that did not change. Now, there were a couple of interesting features from this late analysis that I think are worth mentioning. The first one comes to this issue of the response rate with luspatercept in RS negative versus RS positive patients. So RS means ring sideroblastic negative patients that are in general not mutated for SF3B1. On the original analysis of COMMANDS in May and later on in June, there was a little bit of a difference favoring the ESA in terms of response when compared to luspatercept. What is interesting with the updated analysis at the ASH meeting is actually this has now neutralized. So the response rate is virtually identical between luspatercept and ESA in the context of RS negative patients. And there's also a phenomenon that I did not pay attention with the first presentation of maybe something that we didn't see in medalists. The objective was totally different. But I didn't really realize when we did the first analysis of COMMANDS that is, it appears actually that the duration of response in the subset of patients with RS negative disease is actually longer than we expected, and actually potentially even longer than what we see in patients with RS positive disease. So this is interesting, right? Because the response rate doesn't seem to be much higher with compared to standard of care, but the duration of the response seems to be longer. I think we need a lot more data. We need to have better understanding of what luspatercept does for these patients with RS negative disease. But overall, basically, what we learned from this updated data at ASH is that the response rate, duration of response, and finally, the toxicity profile of this compound are basically along the lines of what we presented at the original meetings. And this is now becoming, in my opinion, a really wonderful agent that we have for anemic patients with lower risk myelodysplastic syndrome. Thank you for your attention.